So let's get to talk about the Kussmaul sign. All right, the Kussmaul sign is a medical sign. It actually indicates something, right? So we'll be talking about the definition. Then we'll be talking about if the Kussmaul sign is there, what does it indicate? Okay, which is the most important part of this lecture. They'll be talking about the associations, like in disease conditions where you mostly see a patient having a Kussmaul sign, right? So you can see this is what Kussmaul sign. You can see it's changing from inspiration to expiration. So you see that in Kussmaul sign, the jugular venous pressure is increased with what? Inspiration. Normally, when you inspire, the jugular venous pressure should decrease. But when you are now inhaling air and the jugular venous pressure is increasing, that's why we say the Kussmaul's sign is there, right? So that the Kussmaul sign is a medical sign that indicates a paradoxical increase in jugular venous distension upon inspiration. Normally, when you breathe in, the jugular venous pressure, okay, should go down. But when you are breathing in and the jugular venous pressure is still increased, that's why we say a Kussmaul sign is there, all right? So normally, jugular venous pressure or jugular venous distension would decrease when you inspire air, all right? And this is due to what? Decreased intrathoracic pressure. But however, in certain conditions, the opposite will occur, and the jugular venous distension or jugular venous pressure will increase even when you are inspiring air. Okay, so this can signify, or it is indicating that probably there's a right side heart failure, there's a constrictive pericarditis, there's a restrictive cardiomyopathy, there's a tricuspid stenosis, there's a pulmonary embolism, or there's a cardiac tamponade. All right, if you see a Kussmaul sign there, you are suspecting for these things. Then in some disease condition, you can see this Kussmaul sign there. So that means it could be that these disease conditions are now causing these things. All right. So you could see if there's an elevated jugular venous pressure, you see it. If there's a hepatojugular reflux, you see it. If the patient has ascites, you see it. If there's a peripheral edema, you still see it, all right? So the sign is named after what? Adolf Kussmaul, who was a German physician who first described this in the 19th century, all right? It is an important diagnostic clue for underlying cardiac or pulmonary conditions. So there's something on the line that is causing this, right? All right, so to access the Kussmaul sign, you have the patient lie supine at 45-degree angle. You observe the jugular vein during quiet inspirations and expirations. Now you should note any increase in jugular venous distension during inspiration. Okay, so just this is what Kussmaul sign is, right? Definition. Definition, significant associations, right? So that's it.